in this we'll continue with the topic which we were doing in the first video. So now in the previous video we have studied about the definition, types as well as causes of peptic ulcer. In this we'll start with pathophysiology of peptic ulcer. We'll see how this peptic ulcer usually occurs. So normally pathophysiology we begin with there will be damage of mucosa due to alcohol consumption, smoking as well as use of NSAIDs and aspirin, or it might be due to the infection with Helicobacter pylori. Okay, so that is either the mucosa will be damaged due to alcohol consumption, smoking, use of NSAID or aspirin, or it might be damaged due to Helicobacter infection. When this occurs, there is damage to the mucosa. Okay, there is damage to the mucosa. When there is damage to the mucosa, and this mucosa it leads to there will be failure of the mucosal layer to secrete mucus, so that it can act as a barrier to secrete. It fails to secrete mucus, so that it can act as a barrier to protect the lining of the stomach. So when there is failure to secrete the mucus, this leads to infective gastritis. Okay, it leads to infective gastritis. That is, there will be inflammation as well as there will be decrease in the intrinsic factor. Okay, there will be decrease in the intrinsic factors. Well, when there is infective gastritis as well as there is decrease in the intrinsic factors, it leads to mucosal ulcerations. Okay, it leads to mucosal ulceration and bleeding. Okay, there will be leads to mucosal ulceration and bleeding. And this when there is mucosal ulceration along with bleeding. Okay, when there is mucosal ulceration along with bleeding, it leads to severe ulceration. Okay, it leads to severe ulceration. So that is pathophysiology of this peptic ulcer. So what is happening? So there will be damage of mucosa due to alcohol consumption, smoking as well as use of NSAIDs and aspirin, or there will be damage to that due to the Helicobacter pylori infection. This when it occurs, it damages the mucosal layer. So when there is damage to mucosal layer, it fails to secrete mucus, which acts as a barrier to protect the lining of the stomach and small intestine. Then it leads to infective gastritis, that is inflammation and decrease in intrinsic factors. This leads to mucosal ulceration along with bleeding. So when there is mucosal ulceration along with bleeding, it leads to severe, it usually leads to severe ulceration. So normally peptic ulcer occurs in the duodenum. Okay, normally peptic ulcer occurs in the duodenum. So this is about this pathophysiology. Understood? So damage to the mucosa due to alcohol consumption, smoking or use of NSAIDs or aspirin, or due to the use due to Helicobacter pylori infection. This damages the mucosal layer. When there is damage to the mucosal layer, it usually fails to secrete mucus, which acts as a barrier to the protective barrier to the lining of the stomach and small intestine. This usually leads to infective gastritis, or there will be decrease in centric factor. So when it usually it is decreased, then it leads to erosive it usually leads to mucosal ulceration along with bleeding. So this usually leads to severe ulceration. So this is about this pathophysiology. So next we'll see about this clinical symptoms. Okay, next we'll see about this clinical symptoms. So what are the symptoms that we can see in this? It's that there will be abdominal blotting. Okay, there will be severe gas formation in the abdomen. Okay, so that is, there will be severe gas formation, abdomen blotting will be there, abdominal pain will be there, nausea will be there with or without vomiting. Okay, nausea will be there with or without vomiting, and there will be continuous burpings. Okay, there will be continuous burping, that also will be there, and also heartburn. Okay, so they'll be having heartburn, loss of appetite. Okay, loss of appetite, and also they'll be having feeling of fullness. Okay, they'll be having feeling of fullness. Okay, they'll be having feeling of fullness due to the excessive acid formation. Okay, due to the excessive acid formation, so they'll be having feeling of fullness. Okay, so that is usually feeling of fullness. So this is, and also unexplained weight loss. Okay, and also unexplained weight loss. So the symptoms usually includes abdominal blotting, abdominal pain, heartburn, unexplained weight loss, nausea with or without vomiting, burping. They'll be having continuous burping, loss of appetite will be there. So these are usually the symptoms that is usually seen, and there's few symptoms which will be life-threatening symptoms. Okay, the few symptoms are also there which is usually life-threatening symptoms. That is, we can see blood in the stool. Okay, when there is blood in the stool, the color will be red or tarry. Okay, the color will be red or black. Okay, the color of the blood might be red or black, and also there will be severe abdominal pain. Okay, there will be severe abdominal pain. Okay, so which is usually very much severe, and also they will be having blood vomiting. Okay, they also will be having blood vomiting, and this blood vomiting resembling the coffee ground color. Okay, they will be resembling to coffee ground color. So these are the 3 symptoms which is life threatening symptoms of this peptic ulcer. So this is about this clinical symptoms of peptic ulcer: abdominal pain, abdominal bloating, burping, heartburn, nausea with or without vomiting, unexplained weight loss, loss of appetite. So this are usually the symptoms which is present, and along with this you can have other symptoms which is life threatening ones, such as bloody stool, severe abdominal pain, and vomiting blood. Okay, and vomiting blood. So next is understood this about this we studied this previously, pathophysiology and clinical symptoms. Now we'll see what are the diagnostic evaluation we have to do for peptic ulcer. Okay, what are the diagnostic evaluation we have to do for the peptic ulcer? So what are the things that we do? First is that we have to go with blood test. So why we have to do this blood test? So this blood test is mainly done to check out the presence of Helicobacter pylori. Okay, to check out the presence of Helicobacter pylori. So that is usually done. And the next thing that we do, it is stool antigen test. Okay, stool test should be done to determine whether Helicobacter pylori it is present in the stool or not. Okay, it is usually present in the stool or not. That has to be done. Then we go with this one, upper GI X-ray. Okay, we go with upper GI X-ray, and then endoscopy will be done. Barium swallow will be done. So this endoscopy and also this X-ray, GI X-ray, everything I have told in the first beginning classes where I dealt with nursing. Like what are the diagnostic procedure that we do in case of GI disorder. So that is usually done. So it is the other diagnostic test we go with this. It is blood test to check the presence of Helicobacter pylori. Stool test to check the this is also done to check the presence of Helicobacter pylori. Next is the next thing that we go, it is GI upper GI X-ray, endoscopy, barium swallow. So along with this they go with, if ulcer is detected, okay, with this if ulcer is detected they go with doing biopsy. Okay, they go with, doctors usually do this biopsy. This biopsy is mainly done to rule out if there is any presence of cancer. Okay, if there is any presence of cancer. So this is the diagnostic test that we go with this peptic ulcer. So that is blood test, stool test, GI X-ray, then this one, sorry, barium swallow, endoscopy, and when ulcer is detected from this they go with biopsy also to rule out the presence of cancer. Okay, to rule out the presence of cancer. So next is usually this is a next till now we have studied like pathophysiology, clinical symptoms, and diagnostic evaluations, and next we'll move on with management. So what are the things that we go with this management? So the type of treatment, or what the treatment we have to give, it mainly depends upon the causative factor of the peptic ulcer. It mainly depends upon the causative factor of the peptic ulcer. If it is like treatment, like the aim of treatment, it is mainly to reduce the acid levels. Okay, the aim of treatment of this peptic ulcer is mainly to reduce the acid level in the body. Okay, to reduce the acid level in the body, and also to reduce the infection of Helicobacter pylori. Okay, to reduce the infection which is caused by this Helicobacter pylori. So that is usually what happens. The treatment usually depends upon the cause of this peptic ulcer. The main aim of this is to reduce the acid level in the body, as well as to reduce the infection which is caused by Helicobacter pylori. So this usually we start with medications first. In this usually the treatment, usually we start with medications first. So different types of medications are usually given to reduce the acid level, also to reduce the infection. The first is proton pump inhibitors. Okay, the proton pump inhibitors. So why we have to give this proton pump inhibitors? It reduces the amount of acid production in the stomach. It reduces the acid production in the stomach. So for that reason this usually proton pump inhibitors is given. So example, it includes mainly omeprazole, pantoprazole, lansoprazole. Okay, so these are usually esomeprazole, rabiprazole. So these are the examples of proton pump inhibitors. The first medication we start with, it is proton pump inhibitors. So why this proton pump inhibitors are given? So this is mainly given because it reduces the acid formation in the stomach. Okay, it reduces the acid formation in the stomach, and the examples are omeprazole, lansoprazole, pantoprazole, esomeprazole, and rabiprazole. So this is usually given. So this is the first type of medication that is usually given. So next is antacids. So the next type of medication that usually we give it is antacid. So this antacid are mainly given to reduce heartburn. Okay, the heartburn and dyspepsia which is usually present. So therefore this antacid are mainly given to reduce the heartburn and dyspepsia which is usually present. So this medication which we give, it is sodium bicarbonate and citric acid. So medication which we give in this antacid, it is sodium bicarbonate and citric acid. calcium carbonate and magnesia. Okay, sodium bicarbonate and citric acid, calcium carbonate and magnesia. So this is first is proton pump inhibitors. Examples are omeprazole, esomeprazole, rabeprazole, and then antacid. It is usually given. It includes sodium bicarbonate and citric acid, and calcium carbonate and magnesia. So this is usually the thing that is usually done. So in this video we have seen regarding pathophysiology, clinical symptoms, and diagnostic evaluation, and few management techniques, and remaining management we'll see in the next video.